total health and healing without being in the hospital. Sounds great, right? The San Diego Vascular Center is doing its part to keep you going strong. Dr. Saloom joining us this morning. You guys focus not just on treatment, but on prevention.
Yes.
What is vascular health?
Well, vascular health is it's a whole package. It looks at like atherosclerosis. You hear about that. You know, we worry about preventing the progression of atherosclerosis, about varicose veins, preventing the consequences of that. So there's a lot involved in vascular health that people don't necessarily think about on a daily basis, but we worry about it.
You are always educating your patients about nutrition and about exercise and ways they can take care of their body. What are some of the tips that you have so people don't end up having to get a treatment?
Well, I mean, if you just watch the earlier segments on this San Diego Living, you see that it's diet, exercise, screening. We do a lot of screenings for those people that are susceptible, family histories, those kind of things. So, diet is like a big thing. Cholesterol, you hear about that. So, especially for arterial disease, we worry about that aspect of your health.
Some of the treatments that you offer, I know, have to do with getting rid of those spider veins. And last week, you actually did an injection in a patient, and we saw something just completely disappear.
Right, and that's a superficial, that's like a cosmetic kind of procedure, and that's that might be part of your social health, that kind of procedure. So. Again, we screen for that, and last week I even mentioned that sometimes there's an underlying cause for varicose veins. So we do vascular vein screening to look at diseases such as that. And we also offer other treatments like laser phototherapy, IPL. We even do hair removal for those kind of things. So some of it's cosmetic, some of it's related, and some of them there's crossover for treatments.
What I was fascinated learning about was that if there are some varicose veins or there's some other issues, besides being cosmetic, sometimes it can be an indication of health problems, something else that's just not quite right with us.
Right. If you've heard of clots inside of your legs, for instance, that's also known as a DVT. We look for those as a cause for some of the varicose veins. Or that kind of thing. It could be a health problem and cause heart problems as well. So that is all the whole package. And a vascular specialist, such as us, we look for those things to make sure we take care of our patients when they come in.
When you talk about screening, what are the things that you're able to screen for?
Well, we look for arterial disease, such that, and there's many components like carotid artery disease. We look for varicose veins. We look for peripheral vascular disease, also known as peripheral arterial disease, for people that have trouble walking. And then we offer treatments for those patients that need that.
You had a picture that we were just looking at of somebody's hands. Yeah. And it's amazing because sometimes people will say, hey, I stayed out of the sun, I used sunscreen, I did everything possible, but my hands are still aging.
Yeah.
Well, you can't really prevent that. So I know that's something that people come in for you to take care of because it helps them feel better from the inside out.
Yeah, definitely. Like we said, it's the whole package. You need to feel better inside and out. So, there's hand blemishes that we treat with the same type of therapy, like the phototherapy that we do. You see pictures that we have up of that. So it's definitely something that we can offer patients that they don't even know about it.
Walk me through a procedure. When I can picture something in my mind, it takes a lot of fear away. When a patient comes in and you have a really relaxing, very comforting atmosphere, what is the process that you take them through?
Well, that depends on the procedure. For like the phototherapy, we did a segment a while back with Dr. Moldovan. He did a phototherapy of some blemishes on someone's arm. But we go through, we talk about the procedure, what's going to happen, what they should expect. We make them comfortable. If they're nervous, we talk about what are you nervous about, those kind of things. And then if there's a procedure that may hurt, we could numb up the area, make it a little numb, and so it's not so bad. So the treatment's much more presentable and pleasant. So.
You also make it a lot more fun because it's cheaper. You're giving folks 25% off treatment. So what do folks need to do in order to take advantage of that?
Well, most of the stuff is that we offer, the discounts and those items are actually in between our Facebook page as well as our web page, which they're linked to each other anyway. So we have a Facebook site that gives everybody updates on what the discounts are, when they're coming up, or what they're eligible for. And there's various things that people are interested in, so it's easy to keep track of it through that. So.
Dr. Saloom, keeping people healthy and helping them put back their short shorts on. Because
Yes.
it's almost summer all year round here in San Diego.
San Diego. That's what we're here
Wonderful.
for.
And again, one quick more shout out of your website.
The website's SanDiegoVascular.com, or SanDiegoVascularCenter.com, and then there's also San Diego Vascular Center on the Facebook.
On the Facebook.
Yeah.
All right. Thank you so much for coming in today, and it's
Thank
a
you.
pleasure to have you. You're going to need to wear your short shorts next time.
Yes.
Okay. All right. You heard him. He said yes. More information, please go to our website, san diego6.com, and click on San Diego Live.